Hi, my name is Dr. Rob Pratt. I'm an upper cervical chiropractor at Arete Chiropractic in Portsmouth, New Hampshire. Today I'm going to talk about concussions and how upper cervical misalignments can play an important role in why some patients don't recover as easily from concussions. Then I'm going to talk about some cases in which upper cervical chiropractic care aided in the recovery from concussions. So in this video, we're going to talk about concussions and how the upper cervical spine can actually be compromised in these situations. Then we'll go over some cases in which upper cervical chiropractic care aided in the recovery from concussions. So what exactly is a concussion? A concussion is a mild traumatic brain injury, or MTBI. It can either be caused by a bump, blow, or jolt to the head, or a hit to the body that causes the head and brain to move rapidly back and forth. These rapid movements stretch and bruise nerves and blood vessels and cause chemical changes in the brain, resulting in temporary loss of normal brain function. According to current research, it takes a minimum of 60 Gs of acceleration to concuss the brain. And it only takes about 4.5 Gs of acceleration to damage the connective tissue that holds the spine together. Therefore, you cannot have a concussion without also sustaining a neck injury. Concussion and whiplash injuries share a lot of the same symptoms. Symptoms like difficulty concentrating, headaches, nausea and vomiting, dizziness, memory problems, and vision problems are all linked to both concussion and whiplash. It is then possible that the lingering symptoms following a concussion are those of a whiplash-associated disorder. The upper cervical spine is a very unique area of the spine. It allows for the greatest range of motion, and because of that range of motion, it is also the least stable area of the spine. So when there is a significant whiplash injury, it disrupts the connective tissue that holds the spine together. And because the upper cervical spine is the most mobile but least stable, it is the first to lock out of place, like this image over here on the top right. Now when the upper neck locks out of place, it puts pressure on the nerves, and the nerves don't work as well as they should or don't function as well as they should. And there are also little ligaments that attach from the bone to the spinal cord. When there is a significant misalignment, it pulls on the ligaments and tractions the cord against the canal, leading to an array of problems. What we want to do is specifically and gently adjust the upper cervical spine to help the body come back into alignment. That will then take pressure off the nerves and the spinal cord and allow them to heal and work as they should. Now let's go over a few cases in which upper cervical chiropractic care aided in the concussion recovery. So this article is called Improvement in Post-Concussion Syndrome in 2 Females Using Low-Force Upper Cervical Chiropractic Care, a case series and review of literature by chiropractor Jonathan Chung. So the first case is a 16-year-old female presenting with dizziness, ringing in the ears, headaches, and brain fog for 3 months following a concussion. She rated the symptoms a 6 out of 10 in severity on average and up to an 8 at its worst. As she had been going through the last 3 months, she had been seeing a physical therapist, an acupuncturist, an ENT, and a neurologist, and with no improvements in the symptoms. Over the course of a month and a half, the patient was seen 14 times. And of those 14 times, the upper cervical spine was adjusted 6 of them. After 5 weeks, she reported 60% improvement in dizziness, 100% improvement in headaches, and 60% improvement in concentration. Case 2 was a 30-year-old female presenting with chronic daily migraines and vertigo following an automobile accident. She reported also with neck pain, back pain, fatigue, anxiety, sleeping problems, and depression. She reported that her migraines were an 8 out of 10 in severity, and vertigo symptoms were a 6 out of 10. The patient was seen 17 times over 2 months, and of those 17 times, the upper cervical spine needed to be adjusted 10 of them. At the 12th visit, the patient reported 80% improvement in migraine intensity, and the frequency reduced from every day to once a week, and she had no longer had any vertigo association with the migraines. If you or someone you know are dealing with post-concussion syndrome or other head and neck traumas, please call the office at 603-380-9184 for more information. Thank you.